All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So some administrative things before we start our talk today about the Delta and its rise and its the vaccination numbers and the contribution to the new cases and so on. One, Margaret, her phone has been, the storage was full and it needed help and it is not booting up for the last couple of days. That is why she is not joining us. So I usually call her. For last 2 days, I've been calling her. Today, I called her before this discussion as well to update her for what we are talking and keep her up to date. So that is one. Secondly, tomorrow, I'll be at the FLCCC. We'll be talking about the long haul protocol. Because I'm the one who led it, I am going to be present there as well. Hopefully, by this time, I would be done. And before this time, I would have taken care of the talk preparation. If not, I might be late or absent from the discussion. But I'll be found at the FLCCC's talk. Thursday, so day after tomorrow, 11 in the morning, we'll have Professor Eli Schwartz from Israel to talk about ivermectin study. Then this weekend, we have an international conference for ivermectin or COVID management, especially the long haul management. And it is by Dr. Tina Pierce. She has arranged it. And I am a presenter for the management part of it. So I'll be, I think, present there. What I do not know is that what is the exact time for my presentation yet. So it might fall somewhere in Friday. And if that is the case, I do not know if I'll be, what time it is. So I'll update you. But this weekend is also kind of booked with that discussion. So with this, let's start our talks and we would go from there. All the links that I have for the discussions, the data that I have for that data, the links are present in the description. I'm just going to very quickly show you the links. Some of these are links to articles which then connect to studies. So I am okay with this kind of a thing. I then go into the study and see how the study is presented. So this is drbeen.com. And this morning I was impressed by the work that we all have done together in last 15 months. 24 million views. Again, for me, there are a lot of views because I have never been a very popular presenter. I usually just focus on students and medical education. And so I have a smaller audience. But 25 million views in last 15 months. And these illustrations that you see here, about 500 videos for COVID topics and about 10,000 illustrations I drew. So my arm gave a toll. So it took a toll for that. But I love these little cute diagrams. Look at these monsters that are sleeping here. So this is a sleeping monster. This is another sleeping monster. This is spilling the cool beans and so on. So I'm kind of really glad that we were able to produce this. And more importantly, we were able to work together to keep ourselves as safe as we could. So this is drbeen.com. This is UK new cases. We'll come back to that in a second. This is the WHO and the names of the variants. So alpha, beta, gamma, and delta. Today we're talking about delta, which is the variant that originated in India. And we will compare at some points this to alpha as well. That is the variant that originated in UK. Before delta, alpha has been the variant that was the fastest or most efficient in infection compared to others. So that was the dominant variant. And now delta is 60% more transmissible and is more infectious. So because of that, delta is becoming the primary virus variant. So this is another from government.uk. This is their release about various data points for alpha and the vaccine efficacy. This is a study that is done about the vaccine efficacy against alpha, it is interesting to see that will vaccine hold up or not. And I would consider that kind of a similarity to infection as well. Will a previous infection, for example, with alpha variant hold up against the delta variant? So that is also a similar question that would be answered by these kind of studies. Then this is BBC. Again, you like them or you don't like them. There is a study for which they had taken some data which I thought was interesting to share. So I have that over here. There is a British medical journal and a study from them about the efficacy of the vaccines against Delta, and especially in the older age. All these references are in the description. This is an article which is based on a study as well, that 5% of the new cases are Delta variant in vaccinated. The rest are other variants or non-vaccinated. And then here, this is also a very interesting article. This is the Delta variant could soon become dominant. And so there are some comparison between US, UK. Then here is the Delta variant causes more than 90% of new COVID cases in UK. In US, it is causing about 60%. In UK, it is more than 90%. So let's see. So discussions continue. Vaccines. First, this is a study, vaccines highly effective against Delta. Once again, this is not a vaccine promotion talk, but more of an understanding of what are vaccine able to hold up or not, one. And secondly, I will be able to then map the same thing to say, okay, if the vaccine generated immunity can do this, then natural immunity, which is in some cases even better than the vaccine, and I have done those discussions, that should hold up as well. So here, if you see Pfizer-BioNTech vaccine, so this is UK data. US data is slightly different, and it makes sense. The socioeconomic statuses, the neighborhoods, the social structures, food, the type of living methods, hygiene, social distancing, not social distancing, density, all of those things, type of health in various people, that all matters. So every country, every community is going to be different. So the data is going to be different between these two. But generally, what we saw is in UK, 96% effective Pfizer-BioNTech against hospitalization. What Pfizer-BioNTech? Fully vaccinated 2 doses. So if somebody is fully vaccinated, so folks in UK, majority were single dose. Once they have the second dose, and then there is 1 week after that, or 2 weeks after that, usually 1 week after that, then the efficacy rises to 96% against hospitalization. So that is very important, and we can talk about this in the chit chat that I have discussed before as well, that getting infection after an infection or the vaccine is fine. It happens. It's not an example of a breakthrough. It is not although CDC calls it breakthrough, or it is not an example of escape. It's just not normal. Oxford AstraZeneca, 92%. So AstraZeneca, 92% effective against hospitalization. So these are good effectiveness, and this is study data. So anybody, I read a comment from someone that, hey, I'm afraid of Delta. And yes, the way Delta has been putting itself out and the way media has been talking about it, there are concerns. I want to look at Delta quickly. 60% more transmissible. 6% of all cases in the US, June 15. Actually, if you see, this was 60 in fact. Anyways, I wrote 60. Pfizer-BioNTech, 88% at preventing the disease. So previously we saw preventing hospitalization, which is in 90s. At preventing the disease, so somebody who is vaccinated with Pfizer-BioNTech, they have 88% efficacy against Delta. Oxford AstraZeneca, 60% effective at preventing COVID. So prevention efficacy is different, and hospitalization efficacy is different. In UK, this is interesting. In UK, the cases are doubling between every 4.5 days to 11 days. And they were saying that if we opened up the society, cases would start doubling every 4 day or faster, and that would cause a huge wave again. And I want to check that with us. So if I go here to UK, look at this case numbers that are increasing. And there is a specific thing that I would like us to see. So check this out. At this time, 7 days rolling average, 7,440. And if I go back to 2000, so here, May 9th was 2000. And at this time, 7,400. So I'm not looking at doubling. I'm just seeing that from 2000 to 7,400. So that is June 14th. So 20, 30, 34 days. If I go back to September when the alpha variant started, so here if we go to 2000, this is September 7. From 2000, when did it reach to 7,000? About September 29. So in lesser time. Again, this is not a fair comparison. Why it is not fair that at that time, society actually had started opening up and people had started, doing their daily chores. And then the variant hit. And all of a sudden, as people were not very careful, vaccination was not there yet. The herd immunity had not reached the point where it should be. So this is not exactly an apple to apple comparison. However, in terms of the speed, alpha almost seems similar to that. Although now it is affecting more non-at-risk people, because at-risk people have gotten vaccines. So more youngsters. So back here, in the US, Delta is doubling every 2 weeks. So slightly slower in the US compared to UK. And this could be, once again, numbering issue as well. UK, more than 90% of the cases are Delta. And the question is, look at this, I have put a red here and a green here. The reason for that is it can be dangerous that Delta has become dominant and it is faster and it is more transmissible. So that means it could zip through the society and cause a lot of damage. That is a red part of it. The green part of this is the following. And Luffy's here. So Luffy's story is that about 2 hours before the discussion, so 2 hours ago, he decided that he is enough happy with not sitting with me. And so he got up and he went. And now he's back to his behaviors. So he was sleeping here before that the whole day. So if you see here, the number of deaths, so that number is still not rising with the number of cases. And what I do not know here is exactly when did the virus became dominant, the Delta variant. So if it became dominant, let's say 3 weeks ago from today, then we would start seeing the results now if it is more lethal. So far, not knowing exactly when did it become dominant, looking at the death rate, I would continue to think that it is not more lethal. But in the coming days, we'll see more. This is the green part of it. It may be that Delta is actually faster, is more efficient to spread, but at the same time, it is not more lethal. And then it is going to more youngsters as well. And so they would survive better. And maybe that would help produce the herd immunity faster. So that is why in here, I have a green border with this as well. Now, exactly what will happen, I think in another few days, we will find out, and then we'll recalibrate the statement. But to me, it will be, if it goes around, it is not more lethal. It produces small, mild cases, some hospitalization, but not lethal. Then it would actually be a better outcome. Consider this, that in the US, it is present now. In India, it is present, but it is not, it is spreading fast, but India's numbers are dropping. That is ivermectin, that is social distancing, that is whatever are the reasons. Vaccines cannot be in India because India is not sufficiently vaccinated. UK is. So UK say maybe it is the vaccine. India cannot say it is vaccine. So they can claim ivermectin, or they can claim just in general the society is either being protected better, they have better habits, or the virus itself is not able to cause too much of a damage. So we'll see more as the days pass by. So this is some data about Delta. Let's go back to continue to see what else is there. Now, efficacy of the vaccines against Delta in the UK is comparable to their efficacy against Alpha. That is a very important thing, which means that the Delta is not able to, and that is a good thing, it's not able to challenge and get out of the vaccine's protection. That means it would not be able to get out of the natural infections protection either. So that's a good news. Then from April 12th to June 4th, this is a different study now. I wrapped up a bunch of studies to look at Delta in a more holistic way. So April 12th to June 4th, this is another study. The people in this study are 14,019. They are all Delta variant cases. Out of them, 166 became hospitalized. So between April to June, early June, 14,000 people, again, this is for UK, about 14,000 people became infected by Delta. 166 became hospitalized. Now, if people had one single dose, then the efficacy against, so when you compare the efficacy of the vaccine with one dose between Alpha and Delta, it is interesting that vaccine's efficacy for Alpha was better, 17%, compared to one dose efficacy against Delta. So those who just have one dose yet, for them, efficacy of the vaccine against Delta is 17% lesser than against Alpha. So they are at a higher risk. But once the two doses are given, the efficacy becomes almost the same, goes in 90s. So two doses, efficacy is the same. One more study, December 2020, last month, to early April 2021. They studied 25% of all patients hospitalized in England, Scotland, and Wales. And 1% of the people who were hospitalized, whatever was the variant, was that some part is going to be Delta and some was Alpha and some others too. 1% of the hospitalized had one shot. And what they saw was in this study that so let's say here is the dose 1 of the vaccine. As the dose was taken, in the early days of the first jab, that means person is still not fully protected, hospitalization was more. And as the protection started rising up, because antibodies, the adaptive arm would start coming in and start making antibodies. So a few days later, it could be 21 days and more. As the protection started rising up, hospitalizations in single dose jabs started reducing. So that is also a very important one. So that means if somebody who just got a jab now, spend more time protected, stay away, social distance, hygiene, try to be as careful as possible. And as the number of days will pass by, the protection would continue to improve. And in this study, what they found was 526 patients were hospitalized. They had first jab. They were hospitalized after the 21st day of the jab. 113 died. There were total 3,500 or more hospitalizations with these cases. So out of 3,500, 526 were first jab. And then out of those 526, 113 died. These results were a little skewed as well because the first, usually the vaccinations were given to people at risk or to advanced age and so on. Then more data. This is June 11th data. So what is the takeaway so far? The takeaway so far is, yes, Delta seems to be faster. Yes, it seems to be increasing the number of the cases. So far, it has not. So this is 617.2 we are talking about. It has not caused the defeat on the vaccinated side after 2 jabs. I would continue to extrapolate that to say that means whoever is naturally infected and recovered, they are in a similar efficacy or better efficacy. And I know that there are people who are going to put this comment over there that who the hell is Mubin to say that natural infections efficacy is better. I have discussed that study. It's a large study on 200,000 people, which was done, and I discussed it last week. So if you feel that I am wrong, please just go and watch that or read that study for yourself. Now, PHE, so Health England, 42,000 cases of Delta from June. So this is June 11th. Out of these 42,000 cases of Delta, they have analyzed 33,206 cases. They are all vaccinated. 1,785 out of them were double jabbed and were the cases. So that is a very tiny number. Out of 33,000 that they have analyzed, vaccinated and becoming infected, only 1,785 were double jabbed. The rest were single jabbed. And look, single jab is actually not a good guarantee. I can get a jab today and develop symptoms tomorrow. I may have gotten the infection a week ago or 2 days ago or 3 days ago, or I might get the infection today. Vaccine is not going to do anything. Tomorrow, not anything. 3 days later, nothing. Until the antibodies start working, until the adaptive arm starts working, we are still waiting for the innate arm to respond. And innate arm does not respond by the vaccine. Vaccine does not do much to the innate arm. It just kind of causes a local reaction. That local reaction and the local innate arm reprogramming is not sufficient for a body-wide response. So one jab and after hospitalization or getting a case is not an odd thing. Still, after 2 jabs, 1,785. Out of these 1,785, 2 jab, double, full protection, 62 were hospitalized. That is about 3%. 3% of this cases. 62 were hospitalized. Is this 3% of these cases? One number here. 12 actually who were double jabbed died. So here is another important thing, and that is vaccinated, fully vaccinated, can fall victim to the infection. The number is very small, but it still exists. This still happens. So 12 people died. Compare that to there were 19,573 unvaccinated, and 23 died from them. So this actually, if you compare them, out of 33,000, 12 died on the vaccine side, and out of 20,000, 23 died. So that's a smaller number. But the difference is because this unvaccinated group is still the group that is low risk, that is youngsters and so on. Now, in the same analysis, 5,393 cases were single jabbed, and out of them 7 died. So this is an interesting proportional issue, and I think it's a data problem. Here, 1,785 and 12 died. Here, 5,393 and 7 died. But once again, the takeaway is that vaccinated folks can fall victim to this as well, a smaller number. This is also a very important thing, and that is that current R naught in the UK is once again 1.2 to 1.4. This number, R naught is a spreading factor. This number was this way in October of 2020. So spreading factor has actually increased. and that is because the delta has increased. Now, delta is behaving like alpha in a community which is more vaccinated compared to when alpha started, in a community where more older age people are protected compared to where alpha started, and even then it is able to push through and spread. The good news I will continue to say is the lesser number of deaths. I would Let's just very quickly look at India as well, because India also has delta. So here, look how sharply the cases are falling. And fine, these could be falling because of ivermectin. These could be falling because of the social distancing. These could be falling for many, many reasons. I think it is ivermectin. It is not vaccine for sure. India's vaccination is not sufficient to be able to say it has created enough protection that the cases fall. UK can claim that. UK can say, hey, we have given enough vaccine that the cases dropped because of it. But if you see here for India, they have a very sharp drop. And remember, when the cases were going up, we were looking at a population of 1.3 billion people. And then the cases are dropping so decently. That means a lot of protection. Now, this is predominantly a Delta variant society as well at this time. And so if Delta was just killing more and spreading more, then this society would be in trouble. So if it is ivermectin, we have done this discussion before, ivermectin protects against all variants because of the way it interacts with the virus. And if you see here, number of deaths are dropping as well. Now, one more country, and then we would move on from looking at the countries. I just want to make sure. US. So if you see here in US, Delta has not become prevalent enough yet. It's not 90%. It is a smaller number. It is increasing. But still, if you see here, the cases continue to drop. US can say that, hey, up to a major extent, this is also a vaccine-driven behavior. But I will continue to balance it out to say India is not a vaccine-driven behavior. There are many other countries that are not vaccine-driven containment of the virus. And the reason I keep bringing this up is to say a society should not say that if we are not vaccinated yet, then we are out of a choice. We have no choice and we'll become victim to it. There are choices. Ivermectin is very good. Vitamin D is very important. Hydroxy, zinc, quercetin. There are so many other things that we have discussed in the past as well. So this is the discussion which I wanted to do. Liza, I haven't seen you for some days. I hope you're doing okay. So Liza says, India News Today, they believe that the number of deaths may be 3 times the number they had reported. That is possible. So please realize that India's reporting system is not as efficient because they were going through this huge spike and the population is not small. So they were then reporting and they were catching up later. Westfield says, for a second it showed 0 cases. I thought we finally had reached China's rate. Westfield, you're okay. So Scarlett says, I think Novavax is safest too. So one more thing that we should actually look at. This is something that a cool bean said. I haven't yet confirmed. And they said that all spike protein vaccines, that is Moderna or Pfizer or Novavax, they all have this in their patent that they have the vaccine generated protein stuck in the pre-fusion state. The reason for that is that they do not want it to go and generate post-fusion state antibodies, because antibodies have very less chance of attacking the virus in a post-fusion. Post-fusion means it has fused, Now, where is the antibody going to attack? So they said that in their patents, they all have pre-fusion spike proteins. If that is the case, and that is a very good news, just like with Novavax. William Goff says, I had a bad reaction to shot one, lasted 3 months, scared the shit out of me. Okay, sorry about that, William. Gold Country says, my goal is to never take a vaccine that is released with an EUA, emergency use authorization. Scarlett says, I read in a daily that started using ivermectin and hospitalization went from 87 to 88%. So, look, this is actually very much possible that for India, we've been tracking them in our morning talks. It is ivermectin. Westfield says, I think it's lockdowns, doctor. When you locked people up, then less victims on the streets. Is UK that strictly locked down again to prevent from Delta? At least in the US, I don't feel that we are in that. Doug says, did Delta come from Delta land? Good, you didn't ask Delta Airlines. Ivermectin real reason for India. Doug, there are two Dougs now. Ivermectin real reason for India. Possibly, yes. So Dr. Julia says 50% vaccinated in Bolivia, still MCO. So look, even in UK, when the vaccination levels were not higher, there were more cases. Even in Israel, when the vaccination levels are 40 or 50%, the cases continue to grow. So I think the number of people that are still available are there. Number one. Number two, after first jab, you still have the person vulnerable. It's really after the second jab and then protection. So we have talked about this, that protection appears from asymptomatic people becoming getting COVID and recovering, children, younger folks, vaccinated fully, then the communities where other coronaviruses or other reasons, or community with the lockdown, they all help protect. Mbal says, that is not because of the Delta, it is because the crappy doctors get it straight. Okay. So for UK, I won't call the doctors crappy doctors, but I feel that many doctors are not able to do the right thing. So Doug Poss, hi Dr. Bean, hello, and Doug Gross. We have two Dougs here. Those numbers aren't adding up for me. So Doug, which number is not adding up? We can look at their original documents. Bambi says, so hey Bam, kind bean, hey Bambi. So UK is staying on step 3 of unlocking roadmap. So they are continuing to say, okay, we are going to continue to open up. Can meet 6 people inside or 2 households, 30 outside. Wedding now unlimited, but must be social distancing and mask wearing. Shops open, nightclubs remain shut. Very interesting. So Kev says that UK is open since May 17th. So May, June. And we see some uptick now. Is it the society opening up and this uptick would have been seen even with Alpha? Or is it a combination of the society plus the Delta? Jody, hello, how are you? And yes, I was also noticing we haven't seen rubies red for some time. We haven't seen Japan for some time. I didn't see Jim for a couple of days. Art patron, I'm reading your comment and I'm smiling. I'm not going to show it. Neeli Das says, so why not we stop in 1 minute and then come back for chit chat? Neeli Das says, Pfizer JP biodistribution study, page 6, showed that mod mRNA encoding luciferase radiance showed up in multiple organs. Dr. Brian Birdle et al. Correct in citing the study. So if you have time, what I did was I requested a friend whose friend is in Japan, Kyoto, and I wanted to actually see where are the issues with that study in terms of translation. And let me show you something very quickly. I am still translating it, so it's not completely done, but what I had said was correct. So people can continue to fearmonger as much as they want and continue to yell at me as well. But at the end of the day, we have to look at what is written, and incorrect translations are not helping. So give me 1 second, Neely, because you brought it up yesterday too. I'm just starting my word. Reality check says, meanwhile, are the vaccines causing the variants due to breakthrough? No. We have done this discussion before, and we can do this discussion in the chit chat after this one. I just want to quickly show part of the translation that I have done with a friend who is in Japan right now. He is Japanese, and my word, I'll be grateful to Microsoft Word if it can load. It has to verify before. So meanwhile, I'll answer some. So Annie says, are newer vaccines like Novavax or Covovax best against Delta variant? So interestingly, Novavax did not claim about Delta. They talked about the Alpha variant, and they said we're very good. The current vaccines we saw were good. So let me just very quickly open up this document. Recent. So going back to the question from Neely and showing what I'm seeing. And this is the translation. There may be still issues with the translation, but other than picking up people's translations that they have done with the Google Translate or they've done with their own bias, here is the summary. And I went paragraph by paragraph. BioNTech code number this is a modified nucleoside messenger RNA that encodes a full-length spike protein glycoprotein. This is correct? And it is for severe acute respiratory. It is being developed as an mRNA vaccine against infections caused by SARS-CoV-2. I think this is correct as well. Concerning the formulation of the BioNTech, lipid nanoparticle that encapsulate BioNTech vaccine are formed hereinafter. They're called BioNTech encapsulated lipid. So actually it is the other way around. Lipid nanoparticle encapsulating the BioNTech. This is just the way the structure of the sentence is, that the subject looks like this one, but it is actually this. By mixing with two functional lipids. So this is an important part. Here is what they're saying. They are saying there are 4 lipids and messenger RNA in this thing. I didn't want to add to this video. It would have become longer, but now we're talking about it. And this, I don't expect to convince anyone. People have their own mindset made, and they would just yell at anyone who who says things differently. But here is the deal. What they are talking about, this author is talking about to the company. They're saying this lipid nanoparticle is made up of 4 types of lipids, in which we will see this 135 here, 315, 159. So 315, 159, cholesterol, and DSPC. And I made them as an illustration to be 4. They are structured differently. And inside this particle, if you open it, inside the particle is messenger RNA, which is called BioNTech Pfizer vaccine. And that is what you would see here. They're saying in these 4 lipid particles, 2 of them are functional and 2 of them are structural. So two are helping to make the structure and two are helping to make the function. So 4 and 2. So that is what they're saying here. Concerning the formulation, lipid nanoparticle that encapsulates this are formed by mixing with two functional lipids, ALC 315 and 159. These are functional lipid. They help with the function of the vaccine. Probably I would expect help to get into the cell. And DSPC and cholesterol are two structural lipids. So there are two lipids that are making the structure and two that are making the function. They said, we wanted to understand the pharmacokinetics, absorption, elimination of 315 and 159, which is contained in this LNP, lipid nanoparticle. So please tell me, where would they say that we are going to be testing RNA or the spike proteins? In vivo and in vitro studies assessing metabolism and excretion. So they said we're going to look at absorption, metabolism, excretion of what things 315 and 159, which is what they are lipids that are participant as functional lipid. This is here in the summary. In vivo distribution test using luciferase or radio labeled lipid. So some folks translated luciferase to be RNA. That is incorrect. They say it in their document that luciferase simply means a shiny thing, right? So Lucifer means shiny. So luciferase is, wherever it is an enzyme. So this is an enzyme that shines. And they call it luciferase or radio labeled lipid. It's a lipid that is radio labeled. Implemented as an alternative reporter. Then they say no PK study was performed by intramuscular administration of LNP because based on the fact that the development of vaccine aimed at preventing infectious diseases does not require evaluation of systemic exposure. So people have been fighting with me that, hey, why did they not do it? I didn't ask them to do this study. We have a study in front of us. The study is, you are happy with the study or you are upset with the study. It is not my responsibility to explain why did they not do this. But this is what they are saying, that, hey, this is what we did. I can understand that a drug company, Pfizer, wanted to understand that we know about cholesterol, we know about the mRNA. What will happen to these 315, 159 parts that we have not added them like this before? So they wanted to understand their pharmacokinetics, and it's a fair thing to do. Once again, I'm not justifying them. I'm just explaining what's there. Also, since the other two, now check this out, Neely, careful. Since the other two types of lipids, cholesterol and DSPC, contained in this drug vaccine are naturally occurring lipids, it is considered to be metabolized and excreted in the same way as endogenous lipids. They're saying we have these kind of lipids already in us and we already understand their metabolism. We understand cholesterol metabolism. We've been working on it forever. Same for the DSPC. So they're saying these two, we don't need to really look at the metabolism because we've seen that. So what is then left? Here, this is another area where people just kept fighting with me. In addition, the RNA is destroyed by the ribonucleases in the cells taken up, and the nucleic acid is charged, and the S protein from BNT is expected to undergo proteolysis. People have a problem with that as well, that who the hell are this company folks or the people who studied to say because we expected it, that's why we didn't study it. That's not my problem. We can go and ask them. But we should at least not try to twist the study. So check this out. They're saying 6 things. mRNA, spike produced by the mRNA, 4 lipids, 2 functional, 2 structural. The functional lipids 315 and 159, structural cholesterol and DSPC. And then they said 2 structural, we know what happens to them. Spike and the RNA, we know what happens to them. So, from the above, it was considered unnecessary to evaluate the metabolism and excretion of these components again. Their fault. They didn't do it. But then don't send it to me and say, look, this proves something. And when it doesn't prove that point, then don't start yelling at me. Then they say, from the PK test for the BNT alternative reporter, LNP encoding luciferase was intravenously administered. Who administers vaccine intravenously? To Wisterhahn rats, and plasma, urine, fecal, and liver samples were collected over time, and her meaning the animals, 315 and 159 concentrations in each sample were measured. What are they measuring here? 315 and 159. And they said why we are doing this here. Because they said we don't think we want to look at the remaining four things. Wrong, fine. There would be other researchers who would find this out as well. And then what do they say? Resulting in 315 and 159 were shown to be rapidly distributed from the blood to the liver. Also, about 1% and about 50% of the doses of these were excreted in the feces, unchanged respectively, and in urine, both were below the detected limit. Now, I'll give you just one more thing. I'm still going over the document and getting it translated, but I'll give you one more thing. Imagine that this document is actually all about RNA. And people are saying, look, it is proving that the RNA is going around. Fine. Let's just take that as a given. Then why aren't we understanding that it says in this document, the bad translated document, that number one, there was no toxicity for liver found even after repeated doses. So if there was no toxicity to the liver, which had 18% of the distribution, then there would be no toxicity anywhere else either. And if there is no toxicity at the injection site where 80% of the distribution was, then how come there would be toxicity where there is 1% or lesser of the product? Secondly, why don't people then understand this, that they are saying within 2 days to 9 days, this whole thing is eliminated. So let's say this was all radio-labeled RNA. Then here is the example of 2 to 9 days that it is removed. And I received people sending me messages that, see, what Dolores was saying, Kahil was saying is correct. Well, she was saying that this would stay out there forever. They are proving it would go over, even if it is RNA. If we assume this whole thing is RNA, they are saying within 48 hours to 9 days, it would be eliminated. So anyways, I'm still working on this document. Let me just stop here for now. I'll come back for a chit chat and we'll do more discussion.